Are you ready to talk about airways today? Are we going to talk about all things that myofunctional therapy can do for you? So I'm really excited about this. This topic really should have been talked about in the very beginning of my entire tongue-tie journey, because this is where my tongue-tie journey began with my favorite myofunctional therapist, Minette. We're going to have a great conversation today. Any questions that you guys might have, you can drop them below and we'll be sure to answer them. But I'll give you a little tidbit about Minette and then I'll invite her on. She's with Exceptional Airways, is her company. She began her career as a dental field registered dental assistant in 2000 and then a dental hygienist in 2014. Served on multiple boards in the Dental Hygiene Association. She's lectured, she's conducted. Let me just tell you, she is smart as a whip. This woman knows her stuff. She's been, in the dental career, she's been a recipient of numerous awards, and she's a lifelong learner, just like me, and always taking continuing education courses. And in 2021, Minette became an Orafacial Myofunctional therapist, and in 2022 opened up her wellness business, striving to help others achieve optimal overall health. And let me just tell you, she is awesome. So I'm going to invite her on, see if I can find her, and we're going to get this party started. Okay. Minette, can you see me? I've invited you on. Yay!
Hi.
Look at you. You look gorgeous.
Thank you. How are you? You look great too.
Thank you. I'm a little hot. A little hot, but I'm excited. I am excited. So let's just get right into it. Obviously, I gave a little bit of your background of what you do. And, we're going to talk about my journey today with the tongue-tie journey and all of that. Oops, there was my mailman. It's okay, Mabel. And, I guess the first thing is, if we want to talk about my journey, or, actually, first of all, what caused you to get into this particular area of focus in your career? Let's start with that, and then we'll dive into what it is and how it works.
So I've been in dentistry since 2000. So I'm going on my 25th year in dentistry. And I've always loved teeth. I've loved smiles. But as I started looking at people's teeth, there was always something beyond that. It was something beyond this beautiful smile. And a lot of people had a lot of issues with not even just their tongue, their mouth, their lips, just even with breathing, speaking, talking, functioning, swallowing,
Mm-hmm.
And as I started to learn more about these muscles and the head and neck, and then even I worked for a sleep and airway. A lot of the doctors I did sleep and airway and TMJ, and I found that this is all related. All these structures are supposed to work together for proper function. When they're not functioning correctly, that leads to dysfunction, whether it's sleeping, breathing, talking, eating. All of that kind of just drove me into, oh my gosh, it's not just about this perfect smile. What does all of this lead to? Then I started going into my own, looking at myself, and I found TMJ patient for years, headaches since I was a teenager, TMJ pain in the jaw, started going down the road of airway, and I have sleep apnea.
Like me.
Yeah, it's and we're not your typical. When you look at us, she's tiny. Well, so are our airways. Our airways are so tiny, and you can't stereotype a certain person. Oh, they're a sleep apnea patient. Everybody has their own issues, and that's how I got into it. And then I started looking at my family members, my kids. If somebody had told me when my son was born that he had a tongue tie and all the issues that I had trying to nurse him, we wouldn't be in this boat with my kids today. We would have solved this a long time ago, because I want my kids to grow up as healthy as they can. So that was why I started to dive into myofunctional therapy, is because now it's not just looking at the teeth. I need to go beyond and look at the actual person and how that mouth connects to their overall health.
Right. And it's interesting you say that, because thank goodness you were curious enough and had a desire to learn more, and knew that it was beyond just getting your teeth cleaned, or the pretty smile, or cavities, or the normal that we, I've always been of the mindset that every disease, every symptom starts in the mouth,
Right.
on so many different levels. But the fact that there are so many in this vast world that we live in, it still baffles me that even like there are some amazing dentists out there, not to knock the dentist or the surgeons or anything that go along with orthodontics, but the fact that this still, I know it's a broad scope of investigation in the mouth, but that it's still so underserved and under discovered or even talked about. So I know for me, when I first, and maybe this is a good way to kind of bring it into to my story. When I first I went to my dentist, got my teeth cleaned, and he said, "Oh, you've got a tongue tie." It was a new dentist. "You ought to get that fixed." He was the first person that said something after 50 some years of going to the dentist. No one ever said anything. He was the first. Then he says, "I'll give you a referral to a specialist who does the tongue tie release." I then called that person, who then said, "We can't see you." Thank goodness she said this. "We can't see you until you get assessed, like fully assessed by a myofunctional therapist." I'm like, "Well, what is that?" And they referred me to you,
Right.
to do the first assessment. So I had no idea what myofunctional therapy, and I have to tell you this, that when that first happened, at first I was thinking like, myofunctional therapist, in my mind, I'm thinking it must be a doctor that does I must need a doc, it's that mindset of, if I'm gonna have someone diagnose something, it just seemed a little odd to me that you're sending me to a therapist to get the assessment, when it seems like it would just be the doctor making the assessment instead of kind of passing it down. But boy, did I learn a lot from you the moment, we got together.
Well, your actual diagnosis did come from your dentist. That's number one. That is like amazing that he was able to identify that. Because there's a lot of doctors out there that, even pediatricians, lactation, there's so many that just don't even look. They don't even look at the tongue. You don't have a lisp, you're fine, but they looked beyond that, and which is great. They need to look beyond just the teeth, right? And the tongue. They're looking beyond. So when when you came to me, you were like, "What the heck is a tongue tie?" And when you came to me, we did a deep dive, right? We sat down and we went through your entire health history. And sometimes I get people ask these questions: "Why are you asking about when I was a baby? Why are you asking how I nursed, how I was born, how did I grow up, all this stuff?" Because it makes a difference. How you started back then and how you developed over these 50-something years is why we are here today. And somebody didn't catch that way back when. So as my job as a myofunctional therapist is, I look at everything. I look at your function, and I look at all this is called the Orafacial complex. All of these work together, and how are you functioning properly? So if you remember, way back in November of last year, we did your initial assessment. We sat down and I looked into your health history. You told me that you were a sickly baby, had trouble nursing, lots of sore throat, ear problems as a kid. You had your tonsils, fortunately, removed at age 2, which is good. But as you started to grow up, remember your history. You had a history of clenching and grinding.
Constantly.
Yep. Fortunately, you were able to find a dentist that did make you a guard, and it did help with your headaches and a little bit of your jaw pain, but there were still some issues underlying, right? You said dry mouth. You knew you had poor posture. You even explained that at age 20, you were diagnosed with pectus excavatum, which when we go later on, I'm going to show you some pictures of what that looks like. And then even your whole body, chronic neck, shoulder pain, hip, tilted pelvis, and you explained all the treatments, all the massages, all the stuff that you tried to help this. And sometimes they just didn't look at that little piece of tissue under the tongue. That little piece of tethered tissue, connective tissue, connects all the way from that tongue to the toes. And it can play a big role. And when it's tight, then your body can't function and move like it was supposed to be, like from an infant. So then I started asking you, okay, let's look deeper into your function. I asked you about your sleep. You said you snored.
Yes.
You have an open, you're all over the place.
But I'm going to say, I didn't snore until menopause hit.
Yeah,
That's what, so I've not been a lifelong snorer. I will own it, but it was not forever. It
right,
just showed up. Like, it was like when menopause hit, I swear, Minette, it's like,
right.
that's when the crap hit the fan.
Yep.
Everything started going sideways and really kind of sent it to the surface. Maybe that was that bay that just.
Your body has been trying to compensate all your life. And then
Mhm.
that little point, right? Whether it's menopause, whether it's pain, whatever, your bucket tipped over.
Yeah.
And where we had to come in and do something, because a lot of times that's what drives people. They're trying to find out what the heck is going on, or maybe that's how I'm normally am, right? I'm
Right.
always snored. I've always slept with, I've always tossed and turned in my sleep. That is not normal. And that's when your dentist actually recommended a sleep study, which we did.
Yes, he actually recommended like a year prior to that. He's a new dentist, so I've been going with him about a year. And I was like, I'm not going to a sleep study. Like, and that was what he had sent me to us out to. And so I just said, no, I'm not doing that, because I'm thinking CPAP, that's not me.
Yeah.
I mean, all the stuff that was going on. But I succumbed to your request.
Fortunately, the sleep studies and everybody out there, sleep studies now are becoming more available, more convenient, and a lot also very reliable. And so we did your sleep study. And what did we find? What did we find with your sleep study?
Moderate.
You moderate apnea, very moderate apnea. You had your oxygen dropped to 73%. 73% in the middle of the night. If you were in a hospital and you were hooked up to a pulse ox in the hospital, the nurses would be like in your room, like, what the heck is going on? Your heart rate in the middle of your sleep went to 117 beats per minute. It's like you were running a marathon in your sleep. So you had even a period where your apnea, remember, an apnea is complete obstruction of an airway. You stopped breathing for 51 seconds while you were sleeping. 51 seconds. I always ask patients, are you able to hold your breath for even 51 seconds awake, sitting up? And a lot of times they're like, no. Well, in your sleep, you stopped breathing. So what does that do? Long term, if you have chronic fatigue, right? Chronic fatigue. When you don't have oxygen that comes to you in your sleep, it can lead to a bunch of systemic diseases and lead to a whole plethora of other things. We can live without food and water for days. Oxygen is a different story. And the body will do anything it needs to do to get that oxygen. So that was only part. The sleep study was a part.
And we also did it for several days. It wasn't like we just did one day and I had an off day. We did it for, I don't know, we did it for a long period of time to see that there was enough pattern, that it wasn't like a one off, I had a bad night.
And then the other thing that kind of was the icing that kind of went with the whole sleep apnea is we took a CT, because you had all these pains, and we got to see where you're at structurally here, right?
Do you have the pictures? Do you have the pictures of those?
Pictures.
Yeah.
So we wanted to see where you're at structurally. We took a CT and we found out your airway, which just really reinforced what that sleep study showed us, was 9 millimeters. So if you think of a boba straw and then you think of a coffee stirrer, that was your teeny airway. And to this day, and I know I told you before, I was like, you are the smallest airway I've seen to this day. Nobody has airway. Well, now it's bigger. But
right. That's what Dr. Lori, I remember when I walked in the room, you and Dr. Lori were there. She was, giving my results, and she says, well, what did she say? Congratulations. I think you might have the world's smallest airways. And I'm like, is that a good thing? Or and so what would the average, I mean, I guess everyone's different, but what would have been a more appropriate normal size airway for someone like me?
On average to be over 100. Over 100.
Yeah, that's huge.
Okay. And so you were like, really the smallest airway I have seen, and we want that. Yeah. And that's a cross section of your airway, so obviously there's a lot that plays into it, but that's what we look at is like, okay, how much room does this patient even have to breathe? So remember I talked about function, and if there are things that inhibit that function, that's where the body starts compensating to try and like be able to function properly, be able to breathe, right? So your body, your years of TMJ, if your airway was closing in the middle of the night and your body was saying, Vanessa, try to open your jaw, clenching, grinding, it was a way for it to open that airway. So when people are grinders, it's usually kind of that fight or flight response to the body trying to open up the airway. So then that just led us down the path of, okay, what do I need to do to fix this, right? So we talked about the myofunctional therapy, and that's why we're here. It's a series of exercises to repattern these muscles, repattern the muscles of the tongue, the lips, the nose, to proper function, right? And then in your case, we were prepping you for an actual tongue tie release.
Right, and let's just back up a minute. So on that C scan, we noticed how tiny the airway was. We also noticed kind of the forward head posture. We also then kind of the next step in that, at the time I was working with Dr. Lori, who kind of started the path. She went in my mouth and did a full examination, right. And which started on the aligners. Can you kind of explain that a little bit to the process of?
Yeah. So there are ways to, when we look at what causes sleep apnea, first you got to look at the structure, right? Because sleep apnea is a disease of structure. It's an obstruction. It's caused by an obstruction to the airway. Okay. So what's causing that obstruction? Could it be skeletally? Is that jaw really small and narrow, that their airway is small? Are the jaws retruded back, that it closes off that airway? Is there nasal obstructions, right? And if somebody can't breathe well through their nose, is it because enlarged turbinates, inflammation, enlarged tonsils and adenoids, and even tongue, low tongue posture? If that tongue is attached to that lower jaw and that lower jaw is back, then that closes off the airway. So as an airway dentist, they're going to look at all of this and then give you what's your best options into how to improve your airway. A lot of that is going to be expansion, right? You can do expansion to change that structure, to open up your airway. It also has to do with the myofunctional therapy, retraining these muscles of the whole face, of lips, tongue, nose, so that you can breathe through your nose and not through your mouth. So when that dentist, whatever their treatment plan is, they decide, okay, here's, what we can see, what we can do, and then we can go from there. And so that way, that's why you have to really, if there are issues that you have with TMD, with sleep, with your airway, you need to connect with an airway dentist or orthodontist, right? And then that way they can look at, because it's a structural issue. What are we working with here?
Right. And so after, like when I had my examination with Dr. Lori, I remember prior to, you gave me kind of, there's this expansion thing that sounded archaic. I'm like, with an expander, I'm like, no, I was in the beginning, no way, no how. And then there's like regular, metal braces, no way. And then, the other option was to start with clear aligners, which is what I opted to do. I'm like, okay, I can handle that. And her hope was that it would give me, we didn't know how much it would give, but potentially a little bit of room for airway. That was kind of the initial path we started on, because I didn't want to do anything extreme. I'm like, I'm not doing it. Like, honestly, I just wanted to see you do the thing, get my tongue tied. Like, all this was just becoming bigger than I had really anticipated.
Right. But my goal, that's what your myofunctional therapist does, though, is they assess everything, right? They assess everything, look at all the different components of your function, breathing, sleeping, talking, and okay, where do you want to go with this? And then we plan your treatment and get you connected with the right providers. So as we did that, you started your expansion path. Then we started prepping you for your release, getting that tongue strong, getting those lips closed, getting you to breathe well through your nose. As we were getting close to you're being ready, your tongue is nice and strong, you're able to keep your tongue up without compensation of any other muscles. That's the biggest thing, is you want only the tongue to move and not do some other funky thing with your face or lips. So we got you ready, and that's when we sent you to the release provider, which was Dr. Zaghi. right? And Dr. Taki is one of the best out there. He does research, and I thought with what we saw in your CT and what we were doing with your sleep, I think that was the way to go, right?
Right. Yeah, exactly. So it was a little more complex potentially with everything. And because we had the choice of the doctor here that was great, but knowing the intricacy of, and I was like, I'm all for it. Like I want to have, if you know, he's also an ENT, which I love that idea of. Um, so I got so excited. I had my Zoom call, you know, for my pre-op, and then I had my call like the right before was like, oh, so I can get it scheduled. And then he looked and says, no. He's like, I can't. You're too much of a high risk. Like I'm looking, and he showed me your airway this, and he goes, I can't. You could have a potentially very poor outcome. Could be dangerous, make it worse. And I'm defeated at this
Yep.
point, completely defeated. I'm thinking, in my mind, I can tell you the story. It's like I spent all this time on my exercises, and I spent, you know, time and money on the expanders, and just totally defeated. The stories are going crazy in that moment. And he says, but there's only one way. And then I'm like, what? And I had a feeling, and he was going to say, he's like, you know, the MARPE, the expander, the gap in the teeth. And I was like, oh God. And then he talked me off the ledge, because I was thinking, no way, no. He talked me off the ledge and said he had done it. He had just had that expansion. It was amazing. His mouth looked great. He goes, you know, it'll be 6 or 8 weeks of the knot. He goes, I have faith in you. You can do this. And then afterward, it'll be, Vanessa, you'll look 10 years younger. And that was like the extra little, he's like, it is like a facelift. It's you know, an incidental. He said all the right buzzwords for me. And I got off the phone, and the next day I called you immediately.
Yep.
And I think you were even shocked, you know, a little bit that he was not going to do it. But
Yeah.
so that.
My first, like you were my first forever, a lot of stuff. My first person that I've ever had a release provider, you know, just say no unless they got the expansion. The very, very first. And which was good because we talked, and I'm like, I get it. I see what you're looking at. And I completely am on board. And I had told her that. I told her that in the beginning.
Yeah, you did.
I did. And so it's not that I didn't, but it was your choice what you wanted to do and how you wanted to start that. And I was going to support you. But if you wanted to go the full way, we had to do the MARPE. And you did it, and you owned it, and it's great. And I'm going to show you, like, let's go through pictures. It was really, I think, honestly, really life-changing for you. And life-changing for anyone that follows you, because they can see your journey and relate. Right. And hopefully they go out there and they find a myofunctional therapist. They find an airway dentist, orthodontist to help them with these problems. I just did an eval yesterday of, she's 23 years old, problems all her life. And she sat here and she's like, you are the first person that has actually listened to me. And they just always just blew me off. Oh, you're just anxious. You're just this, you're just that. And she's like, no, there's something really, really wrong. And so, and I wanted to get to the root cause of it, you know, and that's what myofunctional therapy does. Gets to the root cause of your dysfunction, and how can we get you the help that you need, connect you with the right providers, get you breathing better, living better, functioning better. Right?
Yeah. You know, I have to say, you know, talking about being thorough and listening to your patients, I was so impressed. This is like a shout out to you. Like literally, one, it was great. We ended up realizing that my baby sister is, you know, her son is like best friends with your son. So it was just a beautiful little connection there, which I loved. But I have to say, like, from the very first time that we met, I thought, holy cow, this woman, Minette, knows her stuff. I was so unbelievably impressed with your knowledge, your commitment. You know, I've got you on speed dial with, you know, when you become a client, I text you, answer text you, have given me so much resource and support. It is, you know, extraordinary. You have been an extraordinary gift in this whole process.
Thank you. Thank you.
Yeah.
You know, I want to say too is, myofunctional therapy, because I get this all the time, like, oh, this is new. This is something new. And I said, it's actually not. It's been around since, you know, 1918. An orthodontist first talked about these muscles, these facial muscles, and how they can help correct occlusion. And from there, he talked about how it's a collaborative approach. and really working together with healthcare providers to understand the connection between the mouth and the body. And I know a lot of people are like, how come my dentist didn't say this? I've seen a hygienist. How come nobody saw this? Well, when we go to hygiene school, dental school, we are overwhelmed with so many things. We just have to pass our boards. There's so many things we have to learn. But there's so much more beyond that. And that's where, and I am a lifelong learner. I've taken multiple CEs. Every week I have at least one CE that I'm registered for, because you could never stop learning for the benefit of your own health and the benefit of clients like yourself. People need to know this information, and they need people to help them and guide them in that direction. So,
no, I agree. So we're going to go through some of my images to kind of show the befores and the afters and the durings.
yes, let me get that pulled
And then
up.
and then after we do that, then we're gonna kind of, we'll shift gears a bit about other areas that people, what if they're not dealing with a tongue tie. There are so many reasons why a myofunctional therapist might be exactly what you need, and it may not have anything to do with the tongue. But we'll finish up with my.
All right, let me turn around here. I might have to pull.
Look at me.
So
I'm ready for prime time.
left side is when I first saw her in November, and the right side is when we just saw her in September. So, and even since September, when I just saw her yesterday, stuff has changed already. It's crazy to look at. So one of the key things when we just look at this is, but just look at her smile. One of the things that she pointed out, she's wearing makeup here. This is her natural. And one of the things we pointed out too is just even her, and she mentioned it, her smile and the changes in her wrinkles, those
look at this.
Yeah.
Because it just pushed it forward, and it just kind of brought everything up.
Yep. And those exercises too.
Yeah.
You don't need Botox. You don't need Botox. You start working those muscles like the way they're supposed to be. That's how that's how it's supposed to work and function properly, right? So we look, and if you look at here at her face, really, really narrow. If you look over here, look at even how her smile is. Look at now that big, broad smile, and even that width of face. It looks great, and it's only gonna get better. She still continues to finish her expansion.
Yeah, fine.
So then when
aligners.
Look here. This is with her no smile. Once again, this will really show that the difference in the lines. You can actually see too, this is what she's talking about with her pectus excavatum. You can really see it in here. That, the tongue, part of the tongue tie can help release that tension, but Minette is also doing body work. She's seeing a craniosacral therapist. She's having a massage to help release all this tension here.
Right. And you know what? One thing else I noticed too, I mean, again, obviously I'm wearing makeup on the left when I first started, and I'm not wearing, I had a rough night's sleep too in my purple shirt. I got to be honest. I was not expecting, I'm like, I'm not having this on, I thought this was for private use, but here we are. My point is, I told you yesterday when we were looking at these, I said, wow, I said, honestly, for me, from my perspective, when I look at the no makeup, no, haven't slept picture versus the one where we first started, I look young. I think my face looks younger.
Younger. Yep, 100%. I agree. And then when we look at her overall body, so remember, she's still working on her body work. We look at the asymmetries in the body. She has one arm longer than the other. Her shoulders, here, her right pelvis, as you can see, there's a little tilt over there. And then she's continuing to have that worked out. So as you release in one part, we work with a body worker to help release the tension in the rest of the body. Remember, this is like 50 something years of
right. And I'm doing, I'm doing an entire series of Rolfing, probably indefinitely. I'm on, there's a whole series of Rolf. Every week I have a 2-hour Rolfing session. I just started working with the pelvic floor therapist, about 2 weeks ago. So it is a journey for sure. Like there's still work to be done from that. It's not just a snip and you're done. It does to unwind and reposition the lifelong hold that this tongue tie has kept me in.
Conversations that you've had all this time. So this one is really interesting too, because you can see the change in her face, and I'm going to show you. Let me draw. If you see this line, If you look at her back then, look at how her chin is further back, right? We want that. So she had that slight retruded jaw, which once again means if my jaw is retruded, my tongue is retruded, that closes off my airway. If we move over here, if you look at, see if I can focus, her jaw now is more in a line with her upper lip. See that there's not that much space between there anymore, so that her jaws come forward, which is great. That's opened up her airway even more. Now, then when we look at the angle of the jaw right here, okay? So before, when she first started, it was really high angle. That's that really steep angle, which means she had a really long face, okay? Now, as we work on her jaw and as her jaw comes forward, that levels out here, right? And what that does, so your jaw joint is right here. If that decompresses that jaw, and I can show you on a skull, but if it decompresses, that takes all that pressure off your jaw joint. So much room there. No more pain. No more TMJ pain.
Right. Just what I told you that yesterday. I said, you know, wow, I'm not having like I mean, it feels nice to massage it, but I do not have that same level of like constant soreness that I've had for years and years.
And then once again, we look at her posture. Now look at her posture here. She has her arms are in front of the body. She has the forward head posture. She has and it's hard to tell, but she has that rolled shoulder. Now, when you look at her now, her arms are more in alignment. Her shoulders, her head are all in alignment. All in alignment, because that's how the body needs to work. It needs to be symmetrical and work in alignment. When something's out of dysfunction or out of then it makes it harder. The rest of the body has to compensate. For every inch your head moves forward in a forward head posture, it adds 5 pounds. 5 pounds to the weight of that head. So imagine if I've got this big bowling ball that's sticking out way over here, how does the rest of my body have to compensate? How does the rest of my body have to compensate to be able to support that? Which is
why my head, my shoulders and neck, constant, like severe chronic shoulder and neck pain my entire life that I can remember.
Right.
No wonder.
So looking at this, she's still in the middle, like you said, of her expansion. She had beautiful teeth, beautiful smile to begin with, right? Beautiful smile. And then now you can see it's a little bit brighter. This is where it's the big picture. Here's her smile before, and it just looked like if somebody took her arch and just squeezed it in right there, narrowed it. Even her lower teeth, it might be kind of hard to see, but the lower teeth were kind of tipped in. That happens a lot when the tongue kind of rests on those teeth. On the lower teeth, they tip in. Now through her expansion, look at that broad, wide
so pretty.
arch. You
so
see,
pretty.
Now have uprighted. So once you expand, what does this do for your whole airway? What does that do? Opens that up. So this is just pre-expansion or pre-release. You can see she could barely even touch when she opened, she could barely even touch the top of her teeth. And then even if you can see tiny, she had a little bit of that heart scallop. So that tissue, that tie went all the way just the tip of that tongue. There's sometimes some patients are even worse, that it really does create that heart indentation, but she had a little bit of that indentation. Now you come over here, she can open wide and touch that spot right behind her front teeth without any compensations, without any pain. And look at this, the same thing here, she could barely open. This is all the floor of the mouth. The floor of the mouth is technically the floor of the mouth. It should stay in the floor of the mouth and not come up. And if you can see, her tongue doesn't quite fit well within that arch. And because her upper arch was narrow. As you come here, look at how that beautiful like cave pattern is showing. The tongue is up, and it's starting to fit perfectly well in that upper arch. Really, really beautiful stuff here. So
luckily we got the tags clean. Those things that's my biggest nemesis. Oh, they get stained, but they do help move the teeth so much faster. So I'm hoping a few more weeks that that's done. But that show is remarkable, really, to see the before and afters.
And I take a lot of pictures of my clients because they need to see a lot of pictures and videos because they need to see that. They need to see the changes that why am I doing this again? What is going on? And then that needs to correlate with what they're feeling. Like, how are they feeling? No jaw pain. No jaw pain. Great. More range of motion. The body feeling better. Less tension here in your neck and shoulders. They need to be able to see that and really know, oh, wow, this is helping. You know, this is, I made the right decision to do this for my health.
Right. Okay. So to button up my case, to then move on to some other things within myofunctional therapy, we are at the point now that I've got hopefully just a few weeks left. You know, could be as much as 5, but let's at this point, you know, a few weeks left of the wearing the aligners to perfect the bite and get that all done. And then we made a decision to wait until that's complete.
Right.
And then we will go back in to do
We'll
another sleep study.
Yep. We'll do a follow-up sleep study. And then your Dr. Manuel, your orthodontist, will do a final CT, kind of looking at where's your airway. And then for you, we're going to work on really hone in, now that your tongue is free, really hone in on the function, making sure you have the proper swallow, right? That the tongue goes up to the mouth.
Which I didn't have, which I didn't know. And you was like, you're not swallowing right. I had no idea. Like, literally, I would swallow, and I don't even want to do the thing anymore because I'm not doing that. But
yeah,
but you know, I would swallow and use my whole body to make a swallow, and I thought that was normal.
Don't realize that sometimes they swallow. They're like really.
That was me.
Forcing.
Yeah.
And your swallows, it's a normal function, and it should be passive, quiet, simple.
Right now it is. Now I can do it.
Yeah.
Oh.
Yeah.
I can't think about it. But before I would be like, okay.
Yeah, she would move her head. Yep.
Like that, like a turtle.
Body wave.
It's so crazy.
Yep.
So we're going to work on that. But so far, like I said, everything has been progressing really well. Thankfully.
And I want to say too, because a lot of people are like, well, how long is this going to take? Because you first were like, okay, I need to get this done, be done. I'm like, girl, it might take a few months, but you're going to be married to me maybe for a year and a half.
And I wasn't happy about that either. I have to say, like, I'm being like fully honest. I was like, I want to just get it done. Why do I have to see this? And I have to spend the time, the money, the effort, all this stuff. But I was doing it because I'm like not a quitter, and I'm like in there. But all that was in my mind. I'm like, and I think that's a deterrent, unfortunately, for so many. But I also know that all I've learned is that if you go specifically for the tongue tie, because we're going to talk next about other reasons, but specifically for a tongue tie, do not, please, for the love of God, do not go, if you have a dentist says, let me just snip it, and you have not, you're asking for disaster, you're asking for a reattachment, for all things that could go wrong. It's just not worth it. I am looking back now, I am so unbelievably grateful the path I've gone with each of the things, even if I was like, oh, this is a pain in the butt, this is going to time and effort. It has paid off. And I can't imagine most people that have answered, sending me messages that had tongue tie release without any, they're like, it grew back, I had problems. And the first thing I asked is, did you work with a myofunctional therapist? They're like, nope.
Yeah. First thing, if anybody identifies any of these issues that we like, and you know, like you said, we'll talk about, okay, what would be a red flag, you know, find a myofunctional therapist. Find that person that's going to look at all the pieces of your puzzle and then put them together and try to help put a plan together for you to get you functioning, breathing, sleeping better.
Now,
right?
you work, I mean, obviously, I was happy. I know that I had options. I could do something online. I could do with you. And obviously, I think in a perfect world, I mean, I love, because we're close by, that we've been able to work together. But I also can see where it could lend itself to both being online. Question for you. I know obviously you're in Vegas. Are there plans? I think you are, some plans to potentially to do online, because I know there's a lot of women or a lot of practitioners, I should say, that have, that are doing online assessment, which is awesome. But I'm sure there are going to be people that are saying like, Minette knows her stuff, I want to work with her.
So I do online already. I do have some clients already that I have one in Colorado, Arizona, California. So, but most of my clients do in person, and I give them the option. What's going to be better for you? And a lot of them like in person only because they can actually feel like, they can have me really look at. Not that you couldn't do virtual. I have plenty of colleagues that can do virtual assessments and go from there. And even if you can't find anyone in your area, reach out to me. I can find someone for you. I am, as I mentioned, I do a lot of continuing education. So I'm a Breathe Institute ambassador. I am an Airway Circle member. I'm an AMPMD member, a TOTS training. So I've done all these. I've done a lot of continuing education and become part of these different networks so we can find you the providers that you need. So I always encourage people, don't be discouraged. Like, reach out to me, we can find the help that you need. Whether it's with me or it's with someone else, I can help you find somebody.
Okay, so let's just say, for example, what are the other most often reasons that someone would come to see you? Let's take the tongue tie. Excuse me. We've talked about my case to ad nauseum, so we're going to put that aside. What are other reasons that someone would come to you that would be really beneficial that they may not even realize? Wow, this would benefit this issue.
So, I mean, when we have incorrect oral and facial muscle development, it can lead to a number of things, okay? Whether we talked about having a tongue tie, a lip tie, a cheek tie, all of those can lead to different things. It can lead to tongue thrusting, snoring, sleep apnea, which are obstructions in the airway. It can lead to improper chewing, bite issues, which when you have a bad bite, that can lead to jaw pain, muscle pain. We talked about having that forward head posture, having neck and shoulder pain. If they're always trying to do this every day, just even breathe. That's the other thing why a lot of people always wonder, well, how do I even get forward head posture? Well, if you've ever seen anybody do CPR, one of the first things they do on a person that needs to breathe, right, is they tilt the head up. What they're doing on that CPR is they're basically opening the airway. So I tell people that have forward head posture, you're basically doing self-CPR. Wow. I am posturing my head forward every day in, day out, to keep my airway open, right? At compensation of what? Neck, shoulder, back pain issues. So those are big things that you look at, or even nasal congestion. They're always like, my nose is always stuffy, always having allergies. Well, when we can't breathe through our nose, which our noses are meant for breathing and smelling, if we can't breathe through our nose, we're going to default to breathing through our mouth. Because remember, as I mentioned earlier, we can live without food and water for days. Oxygen's a different story. Our body will get oxygen no matter how it's going to get it, and it might get it even through the mouth and mouth breathing. So mouth breathing is not good for us because we're not getting nitric oxide. We're not filtering the air that comes in through our nose. We're causing a bunch of different airway issues, even periodontal issues, gum, teeth issues, teeth decay. When that mouth is dry, it changes that whole oral environment. And I can go on to mouth breathing and all the bad things about it, and retruded jaws. But there's also other things like, if you're not getting poor or good sleep and getting poor sleep, that can lead to issues for chronic fatigue, right? Brain fog. They found there's lots of research coming out that lack of sleep is leading to dementia, Alzheimer's.
100%. I understand it because I've dealt with all of these things, and it is frightening.
Right. And when you're not getting that proper sleep, proper oxygenation, it can lead to, anxiety. When you're like, oh my God, like depression, irritability in kids. A lot of times in kids, when they're not getting proper sleep, kids aren't tired typically like adults are, or they can be, but sometimes it can manifest itself as ADHD, excitability, and they can't focus. They're all over the place. Well, it's because they probably might not have gotten a really good night's sleep. So a lot of times when parents come to me and they say, oh, he's on ADHD meds, and I'm like, what does his sleep look like? What do you notice? What's going on when he's sleeping? Even bedwetting, in kids is a sign of an airway issue. So, and all of this can develop from what's going on, possibly with their tongue, or for even the structure. Do they have small jaws? So that's what we look at is this little part can lead to, if it's not functioning properly, can lead to a whole array of systemic illnesses and diseases.
Okay, so I've got all of these different exercises that I've been doing, and we kind of pile them on, we kind of add and take away and kind of the routine. Question is, when you're working with a client, and we'll use mine as an example, I've got these exercises I've been doing. Is it something that you do forever, for the rest of your life? Is there a maintenance? What's the buy-in for, if there's a client, if there's someone out there saying, potentially maybe I should go see, but they're also wondering, wait a minute, is this one of those I gotta, like, for the rest of my life, I have to do this and this much of it?
Well, the goal is to retrain these muscles, right? To retrain the muscles so that this becomes your new norm. It becomes a new norm for where does my tongue rest? Are my lips closed? And am I breathing well through my nose? So the goal is, yes, to eventually rehabilitate these muscles for ideal function, right? And I get people, well, how often do I have to do the exercises if I need to? Honestly, if you are practicing proper posture or rest posture and function, then, and your tongue, your lips are doing what it's supposed to be, you don't have to do it for the rest of your life, because it's functioning that way already, So that's what I tell patients, and that's what you have to work on. Like, if you feel all of a sudden that your tongue is dropping, then, maybe I do need to do a little bit more of my exercises to strengthen that back up again. Or I have the other day, a patient's like, I caught myself for the first time in a long time that I actually took a breath through my mouth. And she was like, what the heck? And I said, well, that's good, because then you realize what you just did inappropriately because you were nasal breathing the whole time. So it's one of those things that your habits have changed. Your habits have changed to be able to support that ideal optimal function.
So what I'm hearing you say also is that not everyone, and maybe many of your potential clients that come to see you, aren't going to necessarily be doing something like an invasive procedure, a tongue tie release, or braces, or any of those things. You also have that will solely come to you. You'll work with them in their physical therapy, if you will, of the mouth, and that alone, depending on the severity of the case, can give a great result.
So I have multiple clients that don't even want a tongue tie release or lip tie, cheek tie, whatever.
Or don't have it.
Or even they don't even want to do it. They are just solely coming to me, Minette, I need you to help me with my mouth breathing or the snoring or my sleep apnea. I just want to be able to, or nasal breathe better. Whatever there is, or even be able to just swallow so that it's not loud. I have one person that says, people always complain I swallow like it's so audible for everybody. So they have, everybody has different goals, and whatever those goals are, then we strive for those goals, and all your exercises are based, and their therapy is based around that. And think of it as personal training. I'm your personal trainer throughout this journey to get you functioning better. And it doesn't, and I can tell you that I have a lot of clients that don't even want to do a tongue tie release at all. They are here to just want to be able to sleep better, right? Or stop the snoring, or whichever, So everybody goals are different. Everybody's therapy is different. So, and I always want to stress that is to my clients is, okay, why are you here? What's your main concern? And how do you want to get there? How can I help you get there? So.
Got it. Yeah. And it's interesting, when I first started doing my tongue tie exercises, and we had the lip touch, we had the behind the teeth, and we had the molar touch, we had that reaching this way and up. And I know what I realized was I had the laziest tongue. I could not believe how lazy my tongue was. Literally, I think because it was tongue, I had compensated, my mouth had compensated that everything was being done by my jaw, my mouth, these muscles, not my tongue. It was, that was a big wake up call for me. Luckily, I did those exercises like nobody's business. And the strength is incredible to where it was, but it works. And you know what else? I mentioned to you this yesterday, and I had said this on a previous video, that I was shocked. I was telling my daughter, I'll get Botox twice a year, maybe every 7 months or something. I've done that for, I don't know, for not a decade, but quite a few years. And I said to my daughter the other day, I'm like, when's the last time that I got any Botox? And I don't have anything else in my face that I get accused of all the time. But I said, I told my daughter, I looked at my phone. I said, oh my gosh, it's been, now it's over 9 months. I said, I'm convinced. One, I'm using this new laser device that I love, but I'm also convinced, like when I look at the lip lines and stuff here, this literally having that expansion, two things, expansion, and you're right. You see this all the time, ladies. You know what I'm talking about. You see all these videos now of the face yoga and people are doing you see it, they're all over it. It works because you're all
It's
all of it. It freaking works.
my
So
son
obviously,
like, Mom, you know what mewing is? I'm doing this with my jaw. And I was like, you're doing myo, it's just, it's crazy because there's all these trends going out there and, people want to do this and do that. It does work, but I would caution, it sometimes might not work and you might not be doing it correctly. You need to connect with a therapist because not what you see all the time on, TikTok or whatever might not work for you and you might be causing more problems, but because you have the root cause of what's going on for you.
And that is something that you said in the very, when we first started. I said, look, Minette, I'm going to share this journey. I know there's people out there that want to know this. And you were awesome. You're like, this is great. But you cautioned me to please, with the specific exercises, to not share, to be doing videos on that. A, because everyone is different. Two, if it's not done correctly. And it seems like, oh, that's just a silly thing. You're just doing this or that with your tongue. But now having gone through the process, I can understand that everyone, you do need to have, these exercises can be so powerful and so simple, but it does really depend on, like, what you give me may be different than what you give, patient number two.
Everybody's goals are different. And that's why I said it's really, really catered to, okay, what's the root cause? What's the issue of that? And how can we get you there? So that's really, really key. But that's why connect with a myofunctional therapist so that they can put you in the right direction.
Right. And what about, what's the right age? What's the age range to work with a myofunctional therapist? Is it too old? Can you teach an old dog new tricks? What's the rate, the kind of the ideal range to get working?
So anyone can benefit from myofunctional therapy. So for kids and adults, so the little window, when they're infants, a lot, it's the parents that are doing the stretches for the infant, right? There is a window, from that toddler age till about 5, 6, that the kids really don't understand, and sometimes they might not be able to do the exercises, but there are some things that you could do, and speech language pathologists are great that are trained in myo, because if they're in that window of like age 2 to like 6 or earlier than 6, that they can try to do some other feeding kind of therapies that kind of help promote the muscles. It's really after 6 where kids can really take direction and follow and do those exercises. So, but it doesn't mean that nobody can, there's no age limit. It can be, people can be helped all along the path. And like I said, if you can reach out to any myofunctional therapist, they can lead you in the right direction. I have multiple people have reached out to me and I said, hey, because of your kiddo's age or because of this is where I'm going to recommend you to, because they do this, and this, and I have my oldest client is 77 years old, 77, and she's like doing great. And she's like,
what was her reason for coming to see you? Sleep. Okay.
Well, the TMJ pain first, and then later found out, oh, I have a sleep issue too.
All right. Okay, I got two more questions. Kind of what is a tongue thrust?
So a tongue thrust is,
what does it do?
So, well, what's once again going back to that improper function, right? The ideal position of the tongue should rest, and I'll pull up my little model, should rest in the roof of the mouth here. It should rest in the roof of the mouth. And a tongue thrust is a type of myofunctional disorder where the tongue pushes forward against or in between when swallowing or when functioning. So an improper tongue position can lead to so many things. Poor occlusion. It can push those teeth. It can cause jaw and facial improper development. So it's because that constant force of the muscle or the tongue pushing can start causing changes in your occlusion, your jaw, your face.
My grandson, I was talking to my oldest daughter yesterday about dental things, and apparently my grandson has the tongue thrush. Like he's got a tongue tie. They're afraid to release it without doing all the other stuff because he's got the thrush. And then talk about why is mouth breathing bad? Because I think that's something else a lot of people do and don't realize. Tell us why. Let's talk about not breathing with your mouth open.
So, I mean, we were supposed to, our noses were meant for breathing and smelling. Our mouth is talking and eating. Mouth breathing, your mouth is constantly left open. The tongue is left in a low position. When that tongue is in a low position, that means that jaw is pushed back, which means that can lead to compression of your TMJ joint here, which can lead to pain. Also, when the tongue is not up, it's down. The tongue is what we call like nature's expander. It's a muscle, right? It's strong. That constant force can help develop this arch. So it can help, especially your upper jaw. It can help develop it and widen that arch. When it doesn't, then what happens, like in your case, remember we saw your pictures, it was really, really narrow.
And hanging out on the sides. I didn't have enough the garage was not large enough for the tongue.
So mouth breathing, can cause the development of like these narrow jaws, even vertical face patterns, because we're growing long ways rather than vertical. Rather than vertical. And then, mouth breathing itself, as I mentioned, it causes a lot of periodontal issues, gum issues. Inflammation of those tissues can cause even tooth decay, So, and then obviously the mouth breathing too, as I mentioned earlier, we talk about posture, closes off that airway. So what do I got to do to open up even more? I'm like this, causing that forward head posture. So,
and I've seen that. I mean, you see that. Like, when you start watching, you can see really some interesting things people are doing with their mouths, and you're right. And it's exactly that. It's not even just like almost like this dumb look like kind of thing.
And even overall, mouth breathing just leads to poor blood oxygenation. You're getting oxygen, but not the right way. In your when you're nasal breathing, your nose letting that air come in through your nose, it filters, cleans, humidifies, and then it also helps with nitric oxide. That's produced in your nasal cavities, not in your mouth. So you're not getting the full benefits of breathing. You're not getting that blood oxygenation levels like it's supposed to be, and that can lead to so many, like I said, systemic diseases, high blood pressure, heart failure, dementia, stress, anxiety, sleep deprivation, so much more, just because we're not getting that proper oxygenation through the nose.
Exactly. All right, so the last little comment discussion, we'll make it brief. The sleep hygiene, like I've got my little sleep hygiene. Let's talk a minute about mouth tape. So I'm a mouth taper to keep it closed.
Right.
Which I sleep like a baby with that mouth tape, like much better, knowing that it's tucked in, and then we've got the nose spray.
Yep, we got the nose spray. So one thing I always find, so we don't like mouth breathing, right? Well, we got to find out, okay, why are you breathing through your mouth? Is there something that's in your nose that is causing that obstruction that you can't use it? And when you can't use it, you don't use it, you lose it. So we got to find out first, why can't you use your nose? Is it allergies? Is it, like I said, enlarged tonsils or turbinates? Is it nasal polyps? Whatever it is, we got to find out what that obstruction is. Your CT showed us too that you don't have any obstructions, which is good. You have a little bit of sinusitis, a little bit of inflammation, which is why I have patients always start a good nasal hygiene. So a good nasal hygiene.
I was resistant to. I don't like it. I was so resistant to that.
Is because I want you to breathe well through here. So we need to have it functioning, right? So just like you take a shower every day, you brush your teeth twice a day, I need your nose to be clean. So I have you start a nasal hygiene. So I had you do clear, which I love the clear.
I love that. I'll tag that below for people that might be interested in.
all natural, homeopathic. There's no steroid. It's like just a good cleanse for your nose. And you don't have that risk of, being addicted to it. It's just a good cleansing for the nose. So I had you start on a good nasal hygiene routine, making sure your nose is clear. And then, then we did a little bit some breath work, right? So that we're getting you to breathe through that nose as much as possible. Oh, I forgot to show too on your picture, just even how your nasal passages opened up from your before and after. That even just helped just from your expansion too. And the more you're through your nose, the more I know people are like, oh, my nostrils are getting bigger. It's like, because you're using it. The airflow is getting in there. You're using your nose.
I remember when the expansion, when I had my split from my Marpy, I remember that one of the first things that I reached out to Dr. Manueli, I'm like, oh my God. It was the first thing I noticed was breathing through my nose. And I didn't even know I had any issue breathing through my nose, but you don't know until you make the change. You're like, wow.
Yeah.
Oh, and one other thing I noticed, I have to share, that's so amazing. Once I have the release, one of the first things I noticed is I've always been a chest breather, harder to breathe down. And one of the very first things I noticed after the tongue tie, like the very next day, I go, oh my gosh, my belly is out and like like a baby, like it's supposed to be. And I would have to work really hard at that to make that happen. And as a singer as well, it was always very difficult for me. I'm still practicing that because it's still new because it was so constricted for so long.
Right. Yeah. And I will say with lip taping, because you hear that a lot now, lip taping. You have to make sure that you can breathe well through your nose. No one should lip tape unless they can breathe well through your nose. You're not about, and the other thing with lip taping, it's not meant to seal you up. It's only just to be
I just do here, just a reminder.
Closed, not necessarily close it, but I would never recommend lip taping because I hear it all the time. Oh, I'm lip taping, but it doesn't work. And I'm like, and I rip it off throughout the night. Well, I said, of course you're going to rip it off because if you can't breathe, your body's going to say, hey, what the heck are you doing? And take it off. You only should lip tape if you know for sure you have clear nasal passages and that you can breathe well through your nose. And then the lip tape is eventually just an adjunct and only a reminder to keep the lips closed, right? And the tongue up and you breathing well. So it's just a little reminder. It's not meant to be your only thing to seal off your mouth, right?
Got it. All right. So as you close up, is there anything I've missed or that you want to share that we may not have talked about that you think is important for everyone out there in watching us that might benefit from or need to know?
So my biggest thing is if you have been suffering from whatever, neck pain, shoulder pain, TMJ pain, lack of poor sleep, any of those functions that, and you've seen multiple doctors and they said, oh, you're fine, here's this, or do that, I would seek out a myofunctional therapist. A myofunctional therapist will help you get to the root cause and really dive deep, peel off those layers so we can see, okay, how can we help you? What is going on underneath? And whether it's finding out, what's going on in your sleep with a sleep study, let's see what's going on structurally.
Right.
Find out, because that's not normal. So if people tell you, when I had a doctor tell me because of my son, snoring is normal. Snoring is normal in all kids. I said, what? That is not normal. You are setting up these kids. Mouth breathing is normal. What's wrong with mouth? I hear it all the time. It's not normal. It's not how we're supposed to be functioning. Find a myofunctional therapist to get to the root cause of your dysfunction so that way we can get you breathing, sleeping, functioning better.
I could not have said it better myself. You are awesome. This has been so much fun. It's long overdue. I should have had you again on it from the very beginning of the journey.
Well, you've been asking, and I said I hate being on camera. So yes, that was partly my fault.
I'm so glad that we finally had the conversation. I really hope that this conversation, if it's helped, if you heard something out there that that pertains to you or maybe someone that you know or love or care about, please make sure you share this live. I'll save it. And if you have any questions at all for me about my own journey or anything to do with myofunctional therapy, you can reach out to Minette at Exceptional Airways.
Yep.
Again, you can direct message her. You can leave messages, comments below. You can message me. I am an open book to this. I just know that there is so much benefit to this, to really exploring your mouth and all things inside there as it pertains to the rest of your health. And it's just, it's so underserved.
Right.
And if I can help one person, which I know there have been a lot that have come in and they've gotten tongue tie releases with Zoggy, that are, there's someone seeing you, and it's beautiful. So share this if you found this useful. And again, I thank you so much, Minette, and
Oh,
we will talk again soon. And you got to send me the, you know what, you told me about this thing, and it's for you guys. I will leave it down below. It's this nasal thing. It's going to be part of the sleep hygiene. If you guys, I should put together a little kit for you guys, like your best little sleep hygiene kit. And it's going to be with some essential oils that it's a thing that kind of goes up in your nose and helps you sleep and anxiety and all the good stuff. So I'll post that below, but send me that link, please, because I want that.
thank you for having me, my dear, and you've been doing great in this whole journey. I'm able to take it with you.
Thank you so much. All right, take care.
Bye, everyone.
Bye, everyone. Thanks for joining today. Thank you.